The third topic of this chapter is interoperability maturity models. Hello everyone and welcome to this presentation on interoperability maturity models. In this presentation, I will explain what interoperability is, why it is important, and how interoperability maturity models can help public service owners assess and improve their interoperability performance. Interoperability is the ability of different systems, devices, and applications to access, exchange, integrate, and use data in a coordinated manner. Interoperability is essential for delivering efficient and effective public services that meet the needs and expectations of citizens and businesses. Interoperability also enables collaboration and innovation across different sectors and domains. However, achieving interoperability is not easy. It requires addressing various challenges and barriers, such as technical compatibility, semantic consistency, legal compliance, organizational coordination, and governance alignment. It also requires following common principles, standards, and frameworks that ensure interoperability at different levels and dimensions. This is where interoperability maturity models come in. Interoperability maturity models are tools that help public service owners measure and improve their interoperability performance. They provide a structured way of assessing the current state of interoperability of digital public service and identifying areas for improvement. They also provide guidance and recommendations on how to achieve higher levels of interoperability maturity over time. There are different types of interoperability maturity models that focus on different aspects of interoperability, such as structural, semantic, governance, or legal. In this presentation, I will explain how these interoperability maturity models work, what are their benefits and limitations, and how they can be used in practice. I will also show some examples of public services that have used these models to assess and improve their interoperability. Now let's see the overviews of interoperability maturity models and digital health. Digital health is the use of information and communication technologies, ICT, to improve health and healthcare services. ICT can include devices, software, applications, data, networks, platforms, and systems that enable the collection, storage, analysis, exchange, and use of health-related information. Digital health can support various functions and processes in healthcare, such as diagnosis, treatment, prevention, monitoring, education, research, and management. Digital health has many benefits for healthcare. Some of the benefits are: increasing access. Digital health can enable access to health care services and information for people who live in remote or underserved areas, or who face barriers such as cost, distance, or mobility. For example, telehealth can allow patients to consult with healthcare providers remotely using video conferencing or mobile phones. Mobile health can allow patients to receive reminders, alerts, or educational messages via text messages or apps. Improving quality. Digital health can improve the quality of healthcare services and information by reducing errors, enhancing accuracy, and facilitating adherence to standards and guidelines. For example, electronic medical records can store and display patient data electronically, such as medical history, diagnoses, medications, allergies, etc. Clinical decision support systems can provide guidance and recommendations to healthcare providers based on patient data and evidence-based practices. Enhancing efficiency. Digital health can enhance the efficiency of healthcare services and information by reducing costs, saving time, and optimizing resources. For example, computerized provider order entry systems can allow healthcare providers to enter orders for tests, medications, or procedures electronically, reducing errors and improving efficiency. Data integration can allow the combination of data from different sources into a unified view or analysis. Promoting equity. Digital health can promote equity in healthcare services and information by addressing the needs and preferences of different groups of people, such as women, children, elderly, disabled, or marginalized. For example, consumer health IT applications can enable patients or consumers to access, manage, or share their own health information, such as personal health records, mobile apps, or online portals. Health literacy applications can help people understand and use health information effectively. However, digital health also has some risks that need to be addressed. Some of the risks are privacy and security breaches. Digital health involves the collection and exchange of sensitive personal data that could be exposed to unauthorized access or misuse. For example, cyber attacks could compromise the confidentiality, integrity, or availability of data or systems. Data breaches could result in identity theft, fraud, or blackmail. Ethical dilemmas. Digital health raises ethical questions about the rights, responsibilities, and values of different stakeholders involved in healthcare. For example, informed consent could be challenging to obtain or verify in digital settings. Accountability could be difficult to assign or enforce in complex digital networks. Equity could be threatened by unequal access or distribution of digital resources or benefits. Digital divide. Digital health could widen the gap between those who have access to and benefit from digital technologies and those who do not. For example, digital literacy could be a barrier for some people to use or understand digital tools or information. Infrastructure could be a limitation for some people to access reliable internet or electricity. Affordability could be a constraint for some people to acquire devices or services. Unintended consequences. Digital health could have unexpected or undesirable effects on healthcare services or outcomes. For example, over-reliance on digital tools could reduce human interaction or judgment in healthcare. Overload of digital information could cause confusion or distraction for users. Misuse of digital tools could cause harm or errors in diagnosis or treatment. Therefore, digital health has a high value for healthcare, as it can contribute to achieving universal health coverage, improving health outcomes, and reducing costs. However, digital health also requires careful planning, implementation, and evaluation to ensure its effectiveness, safety, and sustainability. To help countries assess and improve their digital health systems, there are some tools and frameworks that can provide guidance and support. Some examples of interoperability maturity models are Global Digital Health Index, GDHI. Early Stage Digital Health Investment Tool, EDIT, Measure Evaluation HIS Framework. Information Systems for Health, IS4H, and Health Information System Stages of Continuous Development. Let's see each model. Let us discuss about Global Digital Health Index. The Global Digital Health Index is an interactive web-based resource that aims to track, monitor, and assess the enabling environment for digital health throughout the world. It uses 7 key indicator categories to measure the progress of digital health in different countries. These categories are leadership and governance, strategy and investment, legislation, policy, and compliance, workforce, standards and interoperability, infrastructure, services and applications. The Global Digital Health Index uses a 5-phase maturity model to score each indicator, ranging from nascent, phase 1, to optimized, phase 5. The Global Digital Health Index also provides a platform for countries to share best practices, challenges, and lessons learned in digital health. The Global Digital Health Index is a collaborative initiative led by the Global Development Incubator, GDI, and Health Enabled, with support from the International Telecommunication Union, ITU, the World Health Organization, WHO, and other partners. Some examples of countries that have used the GDHI are Afghanistan, Bangladesh, Brazil, India, Kenya, Malaysia, Nigeria, Pakistan, Rwanda, South Africa, Thailand, Uganda, and Zimbabwe. Here are some possible examples of how the Global Digital Health Index can be used in practice. A country that wants to develop or update its national digital health strategy can use the Global Digital Health Index to benchmark its current status and identify gaps and priorities based on the 7 indicator categories. A donor or partner that wants to support digital health initiatives in a country can use the Global Digital Health Index to understand the country's needs, strengths, and challenges, and align their investments with the national strategy and plan. A researcher or advocate that wants to compare and analyze the progress of digital health across countries or regions can use the Global Digital Health Index to access data and insights on various aspects of digital health, such as governance, workforce, infrastructure, and services. Early-stage digital health investment tool. Early-stage digital health investment tool is a tool that helps countries assess the feasibility, desirability, and viability of digital health investments. It uses a set of criteria and questions to evaluate the potential impact, value proposition, user needs, market demand, technical feasibility, financial sustainability, and scalability of digital health solutions. Early-stage digital health investment tool also provides a scoring system and a dashboard to visualize and compare the results of the assessment. Early-stage digital health investment tool is designed to help countries make informed decisions about investing in digital health solutions that are aligned with their national health priorities and strategies. It can also help countries avoid wasting resources on solutions that are not suitable or sustainable for their context. Early-stage digital health investment tool can be used by different stakeholders involved in digital health investments, such as governments, donors, partners, developers, or implementers. Early-stage digital health investment tool is a collaborative initiative led by the World Health Organization, WHO, and PATH, with support from the Bill and Melinda Gates Foundation and other partners. Some examples of countries that have used early-stage digital health investment tool are Ethiopia, Ghana, India, Indonesia, Kenya, Malawi, Nigeria, Rwanda, Senegal, Tanzania, Uganda, and Zambia. Early-stage digital health investment tool is based on the principles of human-centered design and lean startup methodology. It follows a 4-step process. Step 1. Define the problem and the solution. This step involves identifying the health problem that the digital health solution aims to address, the target users and beneficiaries of the solution, and the expected outcomes and impact of the solution. Step 2. Assess the feasibility, desirability, and viability of the solution. This step involves answering a series of questions based on 7 criteria: impact, value proposition, user needs, market demand, technical feasibility, financial sustainability, and scalability. Each question has a score from 1 to 5, where 1 means low and 5 means high. Step 3. Calculate the overall score and generate the dashboard. This step involves adding up the scores for each criterion and dividing by the number of questions to get an average score for each criterion. The overall score is calculated by averaging the scores for all criteria. The dashboard displays the scores for each criterion and the overall score in a spider chart. Step 4. Interpret the results and make recommendations. This step involves analyzing the strengths and weaknesses of the solution based on the scores and dashboard. The tool provides guidance on how to interpret the results and make recommendations for improvement or further validation. The early-stage digital health investment tool model enables the evaluation of the readiness and feasibility of a digital health solution for a particular context. It uses 3 types of indicators. 1. Informational. These indicators provide information about the situation and challenges where the solution will be implemented. They are not essential, but they should inform the planning process. 2. Enabling. These indicators measure the opportunities and advantages that can facilitate or support the deployment of the solution. They are not essential, but they should inform the planning process. 3. Critical. These indicators assess the requirements that must be fulfilled before the solution can be deployed. The goal is to reach stage 3 for all critical indicators before proceeding with the solution. The other model is the Health Information Systems Stages of Continuous Improvement Assessment tool. The Health Information Systems Stages of Continuous Improvement Assessment tool, SOCI, is a tool that helps countries or organizations assess, plan, and prioritize interventions and investments to strengthen their health information systems, HIS. Health information systems are systems that collect, analyze, and use data to improve health service delivery and health outcomes. The Health Information Systems Stages of Continuous Improvement Assessment tool measures the current and desired status of an HIS across 5 core domains and 39 subcomponents, using a 5-stage maturity model. The 5 domains are: 1. Leadership and governance. 2. Strategy and investment. 3. Legislation, policy, and compliance. 4. Workforce. 5. Standards and interoperability. 6. Infrastructure. 7. Services and applications. The SOCI tool also identifies gaps and supports the development of roadmaps to improve HIS capabilities related to processes, people, and systems too. The SOCI tool aligns with the World Health Organization, WHO, efforts to strengthen country HIS and capacities to monitor universal health coverage and health sustainable development goals. The SOCI tool was collaboratively designed by the United States Centers for Disease Control and Prevention, CDC, the Health Data Collaborative Digital Health and Interoperability Working Group, and the USAID-funded Measure Evaluation Project 13. The SOCI tool can be used in 2 formats, an Excel-based tool and a digital, app-based version of the tool available through the DHIS2 platform. The other model is Information Systems for Health Maturity Assessment Toolkit. The Information Systems for Health Maturity Assessment Toolkit, IS4H, is a tool that helps countries or organizations assess their organizational capacity related to digital transformation, data management, governance, innovation, and knowledge management. The tool measures the maturity level of these aspects across 5 stages, from nascent to optimized, and provides recommendations for improvement. The Information Systems for Health Maturity Assessment Toolkit tool is based on 8 guiding principles that reflect the vision and values of information systems for health. These principles are data quality, data use, data sharing, data protection, interoperability, innovation, sustainability, equity. The Information Systems for Health Maturity Assessment Toolkit tool is part of the Information Systems for Health project, which is a mechanism for managing interoperable systems with open data that comes from different sources and that is ethically used through effective information and communication technology tools to generate strategic information for the benefit of public health. The Information Systems for Health Maturity Assessment Toolkit project is led by the Pan American Health Organization, PAHO, with support from various partners. Measure Evaluation His Framework. The Measure Evaluation His Framework is a conceptual framework that describes the components and processes of a health information system, HIS, and the relationships among them. A health information system is a system that collects, analyzes, and uses data to improve health service delivery and health outcomes. The Measure Evaluation His framework identifies 6 core components of an HIS: resources, indicators, data sources, data management, information products, and dissemination and use. These components represent the essential elements of an HIS that enable the collection, analysis, and use of high-quality, timely data for health decision-making. The framework also illustrates how these components interact with each other and with the external environment, such as the health system, the political context, and the stakeholders. The framework shows how these interactions influence the performance and outcomes of an HIS. The framework was developed by Measure Evaluation, a project funded by the United States Agency for International Development, USAID, that aims to strengthen HIS in low and middle-income countries by providing technical assistance, tools, and resources. The project also developed a set of indicators to measure the performance of each component of the framework and a set of tools to assess different aspects of an HIS. The Measure Evaluation His framework also recognizes for cross-cutting themes that influence all components of an HIS: data quality, how accurate, complete, timely, consistent, and reliable the data are. Data demand and use, how much data are needed, accessed, analyzed, interpreted, communicated, and used for decision-making. Data governance, how data and information are managed within an HIS, including the rules, roles, responsibilities, and accountabilities. Capacity building, how the skills, abilities, and resources of individuals and organizations involved in an HIS are developed and strengthened. The framework can serve as a tool to help assess, plan, monitor, evaluate, and improve an HIS. Some examples of tools that use the Measure Evaluation His framework for HIS assessment or improvement are PRISM, Performance of Routine Information System Management; HIS Stages of Continuous Improvement Toolkit; Health Information Systems Interoperability Toolkit. The table compares 5 models or tools that are related to digital health or health information systems. The models or tools have different purposes, scopes, and methods. The Global Digital Health Index, GDHI, measures the progress of countries in adopting digital health solutions using 7 indicator categories. The Evidence and Innovation for Digital Health, EDIT, help investors evaluate the potential and viability of digital health startups using 12 elements. The Measure Evaluation HIS framework assesses the performance and impact of health information systems, HIS, in low and middle-income countries using 6 components. The Information Systems for Health, IS4H, guides the development and implementation of integrated HIS in the Americas using 4 pillars. The Health Information System Stages of Continuous Development tracks the evolution and improvement of HIS over time using 5 stages. That's it for Chapter 4. Thanks for listening and joining in.